Hello, and welcome to the Dr. Nurse Mama Show, prescribing hope for healthy families here on American Family Radio. Here's your host, Professor, Pediatric Nurse Practitioner, and Mom of Four, Dr. Jessica Peck.
Well, hey there, friends, and welcome to my favorite time of day, getting to spend time with you, prescribing hope for healthy families. You know, we talk about a lot of really tough things on this show. We tackle tough topics, and I'm so excited to tell you that today is not one of those days. Today, we've got a feel-good story, something that is going to encourage you, uplift you, and that is fun. Now, what is not fun is all across America, many families are having a common experience. We see access to basic health care becoming a lot harder to find, especially in rural communities. I know I'm seeing that as a nurse practitioner myself, as a professor. We see hospitals closing, we see clinics becoming more expensive, and especially in rural places, there's just not a lot of options. We see providers who are stretched thin. Maybe I live here in Texas, they're covering multiple counties. For many families, something as routine as a checkup or just managing a chronic illness or getting care for a sick child can mean hours on the road and a lot of fear in the hearts of parents. But what is more striking is this: the solutions aren't always coming from big health systems or national programs, although those do exist. Sometimes some of the most innovative, inspiring solutions start locally with people who see a need and feel called to step in. And that is what today's conversation is about, that kind of story. And I hope that you won't just listen to this story and think, oh, that was a great story. I hope that you will pray and reflect and think, what might God have for you in your own community? Where could you step in? Now, this story we're telling you today is one that's rooted in calling and community collaboration. And it's a story that reminds us that healthcare is not just clinical. It is deeply relational, and it is a community affair for sure. And we know that God calls us not only to care for people, but to care for their families, to care for our communities with compassion and with practicality. And so we're going to talk about what happens with community partnerships and collaborations. What happens when that stops operating in separate spaces, but people use their gifts and come together. Now, to give you an intro to this, I'm going to play a short video, which you can listen to, but you can also watch the whole video. This is a video that features a YouTuber. Some of you will know, some of you will say, wait, who is this? If you don't know who it is, ask your grandkids. But this is Mr. Beast. This is a YouTuber who has a philanthropy arm called Beast Philanthropy, and we're going to let them tell you what they have done, and then we're going to talk to the players involved. So, Marty, let's play the clip.
What if I told you we could turn this shipping container into a life-saving medical clinic? This is what the shipping containers look like before we do anything. But once we're done, it will literally look like this on the inside. The clinic we've been working on is going to go over to Massachusetts at the end of the video. But that's not the only project we're doing in this video. We're going to send 5 unique clinics to medical deserts around the world, where getting to a doctor just isn't realistic. Got a lot to do in this video. Let's keep working. Nolan, have you ever used one of these things? No. I think you put your hand right there. Oh, dude, nice. Okay, here you go. What do I do with this? I don't know, they just told me to cut it in. We only had a few hours before the truck arrived to take this clinic to its final destination. Wow. Each one of these clinics is custom built to serve the community they will go to. And what's crazy is that these clinics have been built entirely by college students. And since build started in 2013, these students have deployed 60 clinics in 24 countries and have already impacted over 200,000 people. We got some more work to do here, but let's go see how Madge is doing in Texas.
We are currently driving through Texas to a small city named Chester, where we're going to be delivering a life-saving medical clinic.
Because of how remote this town is, getting medical care in an emergency is extremely hard. Just this year alone, the school in Chester has had 2 medical emergencies, where they had to wait almost an hour for an ambulance to arrive. And when help is this far away, every minute matters.
This is the first medical clinic here in Chester, Texas. I mean, this is insane. We saw the first iteration of it. It's literally a shipping container with wood, and now this is a fully fledged operating medical clinic. One of the coolest things about this whole clinic is that they have a telehealth center. Doctor shows up here, we sit here, we get diagnosed, we tell them exactly what's going on with us, and they'll have a solution.
This new clinic will be run by Timber, a local hero who was born and raised in Chester.
I'm a fixer. I like to try to fix people. I have a caring heart, but my mom was probably my biggest inspiration.
You're gonna make me tear up. Oh, I am so proud of her.
I think I was put on this earth to care and make sure my family and community are taken care of. I would get emotional. It's just who I am. This is my home, and I thank y'all. Thank you.
Chester, Texas, make sure you guys go check out your clinic. We really do appreciate you guys taking the time to come out here.
Now this entire town has access to healthcare right on their doorstep.
This is making a difference in the community. This is helping people get healthcare for the first time in their lives.
This is making a difference in the community, and we're going to talk to the people who were boots on the ground making a difference. We have 3 guests today coming to us talking about this clinic that's going to go into Chester, Texas. First up, we have Dr. Natalie Baschynsky. She is a longtime friend of mine, a family nurse practitioner, a nurse scientist, a rural healthcare advocate, really just a community hero. And Dr. Baschynsky left a successful academic and research career to bring accessible, compassionate care directly to underserved families in East Texas. And she runs a clinic there in Houston County, and amazing. Our second guest, as you already heard on the video, is Timber Wright. She's a family nurse practitioner, a next generation rural healthcare leader. She is deeply rooted in her community. She serves families across the lifespan. She brings both clinical excellence and lived understanding of rural life. And last but certainly not least, we've got Pastor Jordan Wilson. He is the founding and lead pastor of the church in the country in Woodville, Texas. And Pastor Jordan is committed to building a faith community that not only preaches the gospel, but actively meets the needs of the people it served. Okay, I am so excited to be able to talk with you, to see this vision come to life, because many people enter healthcare to help others, but sometimes that calling grows into something deeper. And so I want to start with you, Natalie, with Dr. Baschynsky. Let's start with you. I would love for you just to introduce yourself to our listeners. Tell them how you did leave a very successful researcher career at academics, and you went and moved out into a rural county, and you have been changing the hearts and lives and health of people for over a decade now since. Would you introduce yourself?
Yes, I'm Natalie Baschynsky. Thank you for having us today. As you mentioned, I'm a family nurse practitioner. In the past, I was also a professor and faculty member at UTMB in Galveston. And part of what I did there was lead a research program where we did interprofessional care in rural communities. It was actually with medically fragile children, where we went out and did home visits and tried to help families find resources and provide education for the families that were struggling and the kids that were struggling. And what I found through that process was that a lot of times it was more lack of resources that really led to the health problems that the families were going through. And so that really motivated me to think outside the box. And I just felt like after seeing what these families were going through, I just couldn't stay in an area that I was in. And so made the move out to rural East Texas. And we've been serving out here I've been here for about 10 years now. Opened Houston County Family Medical Clinic 6 years ago. And during that time, started collaborating with Texas A&M on their rural health board through the School of Medicine, and really found out about some innovative programs that they were involved in. And that's how this collaboration came about, trying to help serve communities that are even smaller and more underserved than the one where we currently are in Crockett, Texas. So found out about the needs in Chester, and Timber Wright is actually a nurse practitioner here at this clinic, that she's grown up in the Chester community and they have never had healthcare within their own community. So we decided to expand with the help of Church in the Country and Texas A&M with the BUILD program. And it's been a wonderful adventure getting everything set up.
Well, Natalie, I am just amazed at what you have done. I think about, just the difference that you have made in your community, where your patients have access to care where they didn't have before. And now you've been such a consistent presence in that, and being able to share that somewhere else is really exciting. So Timber, let's go to you and let's hear your story and how you started working at the clinic and how you got the opportunity to step into your hometown.
Yes, so I'm Timber Wright. Like Natalie said, thank you for having us today. So how I got involved with Natalie and Houston County Family Medical Clinic, I was actually working at a hospital in Lufkin, and my boss was actually from this area, and I needed some clinical hours. And she said, I have the perfect clinic, the perfect people for you. So she kind of got me in contact with Natalie. I did probably 3 or 4 rotations to this clinic, and it was a family atmosphere. Even though, it's about 60 miles from Chester, Texas, but I was already used to having to drive, 40 minutes to work anyway in Lufkin, but it was just family oriented, and we just kind of hit it off right at the bat, and I knew I loved them and I would drive to see them. And it's just been a great experience so far. And like Natalie said, she's the one that kind of got this, A&M build start going for the Chester community. And I'm excited because, that's the community that I grew up in for 29 years. I still live there. That community has, I get emotional talking about, Chester because they just mean a lot to me. I do it every time. They have shaped me into the person I am today. And I want to give back to my community because they've given back to me so much.
Absolutely.
Don't you dare apologize for being emotional, for caring about your people. That is nothing ever to be sorry for. And we're going to get to Pastor Jordan in just a second, but let me sit here with these 2 nurses for just a second. And Natalie, what are you seeing as the opportunity? Well, actually, let's go back to Timber here. Timber, I'll give you just a second to collect yourself because you love these people. Talk about what it's like to know these people. I mean, these aren't just strangers. These are your friends. These are your family. These are the people who work and serve you in the community every day. What are the actual needs that you're seeing? We heard it on the Mr. Beast video about even some needs in the school. What is the real life impact of not having healthcare access in Chester? What does that look like for everyday families?
I mean, a lot of people, can't get out and drive, 30 minutes down the road for healthcare. A lot of people lack education, like Natalie said earlier, resources. Like these people just don't know how to take care of themselves. And like the school, like I said, they'd have to drive 20 minutes up the road just to kind of go get healthcare. And with me being there, if a kid's sick, the school nurse, can definitely call and send them over with their parents. We can get them checked out. And if they can go back to school, it helps produce the numbers up in the school with kids, attending school. Just the education part's a huge thing to me. Just people have no idea, how to take care of themselves. And it's easy if they have the proper health care and education. So I'm excited to bring that to the area and the community as well.
Well, it's really great just to see God putting you all in the right place at the right time. And I certainly see that with Natalie's giftedness and strengths and being able to coordinate this partnership. And we're going to talk more about that, what that partnership looks like. It's so intriguing to look at it, to see that if you're watching the video, if you're watching the streaming, or if you're just listening, let me describe it to you, because we're talking about a shipping container. I mean, it just looks like a big hunk of corrugated metal. And for somebody just looking from the outside, you would maybe not have much imagination for that. But when you see how this can become a clinic, and you see engineering students from Texas A&M stepping in to be able to engineer that space to function, to provide some of those services that you just described, Timber, this is literal life-changing, life-saving work that happens. And it only happened because you all said, yes, we'll serve our community. That is really exciting. When we come back, we'll also hear from Pastor Jordan Wilson about the church partnership that happened with this. And we'll talk some more about what it looks like to walk into your calling with courage. And we will hear more about that. If you want to go see the rest of the video also featured other shipping containers that were put to all other parts of the world, including Africa. But we're going right back to Chester, Texas, out in East Texas, when we come back. We'll see you right after this break.
I vote for family.
I vote for legal immigration.
I vote for religious freedom.
I vote for law and order.
I vote for our children's future.
I vote for peace through strength.
I vote for life.
I vote using iVoterGuide.com.
In the valley of the shadow, I got a feeling it's season that'll make me grow. I'm still breathing, I got praise in my lungs, and a choir in my soul can't steal my joy. Can't steal my joy. What the world couldn't give, no it can't take away. Sorrow may come, but it can't steal my joy. Can't steal my joy.
Welcome back, friends. That is Can't Steal My Joy by Josiah Queen and Brandon Lake. And you can't steal my joy today. I've got two nurses on the show with a pastor, and we're talking about a very unique county partnership, a community partnership that's happened to take a shipping container, have engineering students retrofit it to become a clinic in Chester, Texas. That's a rural place in East Texas. And we are talking today to Natalie Baschynsky, a nurse practitioner who was the architect and the coordinator behind that partnership. We're talking to Timber Wright, who is the nurse practitioner who's going to be providing care there. And we're talking to Jordan Wilson, who partnered his local church with this effort. So we're right in the middle of the story and how this came to be. Natalie, I want to go back to you and talk about how I just see God putting you in the right place at the right time to be able to use your gifts and talents that you had to bring this partnership together. Can you talk a little bit more about the logistics of how this dream came to be?
Absolutely. So, as you mentioned, we made the decision to say yes, which has always worked out for me. Basically, if there's something that I feel like there's a need and there's a creative way to get to it, I think it's just being willing to, to take that first step. And when we found out that there was the opportunity, because so many of the shipping containers had gone overseas, when I found out that there was an opportunity that one of the shipping containers could be placed in Texas, I was very excited because as much as, we love having Timber here, it is an hour away from her home. And we were seeing that, she had a lot of needs in her community and wanted her to be able to feel like she was giving back to her community in addition to being here where we are in Houston County. And so for us, building a clinic from the ground up there just wasn't attainable. It just wasn't something that we would be able to make happen in the time that we needed. And so when this opportunity came with the basically service learning project through Texas A&M, I just jumped on it because I loved the way that all of the students came together and just seeing how with the other clinics that they had put together, just hearing the stories of how they connected with the community and how the community supported them. And that's really exciting because with projects like this, you have to have buy-in from the community to make it successful. And so we just stepped out there and we're lucky enough to have Church in the Country to help us with a lot of the logistics also and helping us find the right people to, get the clinic there and on the ground and all of the prep work done and plumbing and septic and electric and all the other things that have to go into getting the clinic functional. And that's been a large project, as you can imagine, being in rural areas, it's a little bit harder to find companies to help with establishing sites. And so having a local partner with Church in the Country and also helping us with some of the fundraising that we needed to make it happen, it was just an integral part of the whole process.
Well, let's go exactly there. Let's go to Pastor Jordan Wilson from Church in the Country. And, Natalie, one of the things I love about this story is just seeing the long arc of it. You talked about, your days at UTMB and running this $1 million interprofessional grant where you really forged community partnerships to help better serve the health of the community. But then, just feeling called to go out and starting Houston County Family Medical Clinic, and how successful that has been. And now you're able to do that. And Timber, who was driving 60 miles to practice, is now going to be able to practice right there in her hometown. Jordan, let's talk about your story in here. How did you come to pastor Church in the Country? And tell us more about your role in the partnership of this community event here, effort.
Well, hello, Jessica, and thanks for the opportunity to be on the show today. It's a long story. 2013, started Church in the Country. I'm from a nearby town. Started as a cowboy church, but knew all along that we didn't really have a lot of cowboys. People think Texas is full of cowboys, and
they do.
Certain parts of Texas are full of cowboys, but we relate more to Southern culture than Western culture where we are, and so we said, well, let's just do country. Let's go country. And so over the span of a few years, we morphed from Tyler County Cowboy Church and Tyler County Country Church into Church in the Country, and got to a name in Church in the Country that we felt like was something that could be used in other places besides just where we are in Tyler County, which we also have a location that we started at Lake Sam Rayburn and close to the Brooklyn community that's doing well now. And our hope is to start more Church in the countries all over the country in the future. So we've got a big vision, and we believe in doing things well and doing things at high quality things church wise. But doing them in a way that will relate to people. We serve country folks, rural folks, and so we speak the language that they speak, and that's important for us to do that. Anyways, we've been doing this since 2013, and just have had been blessed so many times at our church, and probably the largest church in our area now, and just God's done amazing things. And so we've I don't know, Timbers and her family, parts of her family have been going to our church for many years. And when this opportunity came along, we heard about this. Timber reached out and said, "Hey, I got something for you to look at." I thought, "Oh, cool." And the cool thing is, Chester, where the clinic is, my kids go to school over there. So we don't live in Chester, but we live about 15 minutes away. And I make that morning commute twice a day. Well, morning commute in the morning, and I pick them up normally in the afternoon too. So I'm over there all the time. And like Timber, just have fallen in love with the community over there. And so when we had an opportunity to partner with Natalie and Timber and Texas A&M, we jumped at it. And the way Texas A&M does this is basically, and again, these have been going out all over the world, but they require a nonprofit partner that basically, when it's all said and done, the property and the structure goes into the nonprofit partner's name. So basically, the way it's set up, they had to have a nonprofit partner actually own the facility, own the property. And so that was us, and that is us. And so we're excited to be a part of that. And our church has helped out some financially as well, but most of the donations have come from Texas A&M, and other donors, like Mr. Beast, from all across the country. So that's our role in it. We're here. We're just here to kind of do anything that we can to help out. Little things. We're nearby. We're kind of just getting into it. Right now we're trying to figure out how to get electricity cut on and plumbing, all that kind of good stuff. So we're using resources that we have, people that we know locally, and just kind of pitching in. So we're excited about this thing opening up here pretty quick, and just really believe in Timber and Natalie and their whole team, and just I see the need, and honestly, I wish we could start 3 more of these. I mean, we don't just serve Chester; we serve 4 or 5 different communities. We're kind of a regional church. We're not really in one community. We're kind of outside in the middle of a bunch of other communities. So we have folks coming from 30 to 40 miles away a lot of times to come to our church. And I just see the need for this in so many other places. And I wish we could figure out how to do it 3 more times.
Well, who
It's
knows?
a big need.
Maybe there's a donor listening here, but it is pretty amazing to watch the video. You know, I showed the first couple of minutes of it, but then right after that, you go to Nigeria, you go to Kenya. That's where some of these other shipping containers are going, and to see that there is a need right here in the United States for that kind of access to healthcare. Pastor Jordan, I want to dive into that a little bit more. You keep saying, I see the need, and I see you, you know, as a pastor, you take care of people, but people are body, mind, and spirit. And, you know, anytime you go to any church service, if you ask for prayer requests, most of the first prayer requests you're going to get are about people being sick, people being hurt, people having healthcare needs. You know, somebody's having surgery, somebody's got cancer. That's when the church is going to show up with the casserole at their door. And so much of that physical healthcare need that they have, it impacts their spiritual needs. It impacts their holistic self. So can you tell us more, Pastor Jordan, about how you see that need presenting in the church environment where you're pastoring?
Well, a couple things on that, and Timber kind of answered this question a little bit earlier, and I want to kind of circle back around to that. You know, why is it important? Why does Chester and why do these communities need something like this? Just in thinking about this and being interviewed by Mr. B, some of their people, one of the things that came to my mind was we can't measure how many lives are going to be saved because that clinic is right there. Because people having to drive 30 or 45 minutes to an hour to get something checked out, a lot of times people would be like, and you know, some of us good old country folks, we're hard headed, right? You know, not Timber, not her, but a lot of the other folks around us, and definitely not me. I'm good. It'll be fine. I ain't going to drive 30, 45 minutes to go get something checked out. And so they don't go, and something that's small turns into something bad. It's like, I'm not a doctor, but I know that a little cold can turn into pneumonia before you know it, and you got a big problem, right? Mm-hmm. And so how many lives are going to be affected and how many lives are going to be saved because that is accessible and right next door? You can't measure that, but I believe that's a big thing. And so I would say that that's a key thing for us. And I also, you know, I believe in small town USA. I believe in rural America. It drives me crazy that we get the bad end of the stick sometimes, you know? And so, my mentality as church in the country, as pastors living here, I'm all about right here. I love these people. I love this way of life. I believe in it. I think it's the best way of life. I think it's the best way to live. And, I'm all for anything that's going to help us. One of the other things too, that I would say that I think really is key. And from my personal side of things, I've had some mental health struggles in the past. I have. I mean, there was right after COVID, there was a time where I had to step out of the pulpit because I literally couldn't be on stage. Like I just couldn't deal with it. I was panic attacks. I've been doing this for 13 years, preaching. I don't know how many messages, but I was having these panic attacks. And I couldn't do it. Like I don't know what was going on. I couldn't go into a restaurant. I couldn't be anywhere really. Like I was in the bed, in the fetal position. I was messed up. I don't know what happened. I think now I kind of understand it after going through some counseling and stuff like that. It was a lot of years of just, I think, bitterness and lots of, you know, emotional trauma things, pastors that we see, you hear. I mean, it was to the point to where like people would call me and tell me about what was going on in their life, you know, like a health crisis or whatever. And I couldn't listen to them. Like I had to turn down the radio or the phone or whatever. I got just to put my phone away from my ear and just say, okay, yeah, I'm praying for, you know, I couldn't listen to it. I was in a bad spot. And so I got help, mental health help. I went and visited with a psychologist, Christian psychologist, and worked through this. And I've come back better than ever. And I haven't had any problems since then. And so one of the things that came out of that for me is how important it is, especially in rural communities, that we think about and we offer services that can help people with mental health. Mm-hmm. And one of the things about this clinic that I don't think we've mentioned that's coming is mental health help. That's going to be available, not necessarily inside like in person, but I know that it's going to be available through the telehealth in Texas A&M. And so that's one of the things on my heart. And I don't fully have the answer to that just yet, but the limited access to mental health help in these small communities is a tremendous need. We had a guy that goes to our church a few weeks ago, took his life. I had no idea. Nobody had any idea. If we had known, if one person would have known, I guarantee you, we would have set down everything we were doing and had that conversation with that guy. Who knows? If he'd had access to something close by, maybe he would have went and got help. And so I can talk about this all day long, passionate about this, but I believe in what we're doing. I believe in Chester, but I believe in this method of Texas A&M going out and how they're doing this. And one of the things that's pretty cool too, I think what needs to be mentioned, is that they name these clinics after fallen Aggie soldiers.
Yeah.
And so that's pretty cool. We got to go to the dedication there back in the late part of the fall, or back in November, and kind of meet some of the families and stuff, Gold Star families, and that makes it even more special, And so, man, we're just blessed to be a part of this, and I've loved getting to know Natalie, and it was cool being a part of the Mr. Beast thing there. Madge, I did know who Mr. Beast was, okay? So I didn't know who the guy coming was, Madge, and it was cool to meet him. But I tell you what, those videos, they're pretty good. They're pretty interesting to watch. You get lost in those things.
I'm betting, Pastor Jordan, that your kids were part of you knowing who Mr. Beast was. I'm just going to go out on a limb there and think that, because kids do teach us so much. And Pastor Jordan, I want to say that I am very confident that just the way that you shared your story so transparently, I know it helps somebody. It helps somebody who is listening, because it means a lot for someone who's in the pulpit, who's supposed to have it all together, say like, oh yeah, it's fine. I can get through it. That, sometimes we just look at those through just a spiritual lens of need, but there is also a mental health need. There is a physical health need. There's an emotional health need. And talking so transparently about how you got help and you found recovery is really important. And I also do want to honor the namesake. I think it's First Lieutenant Matthew Van de Grift is what I have. And that is the fallen soldier who will be honored through this. When we come back, I want to talk some more to Timber about what nurse practitioners do in the community and the services that they provide and the holistic health perspective that they have. And if you're out there listening and thinking, you know what? Maybe I could step up and say yes to something. You know what that opportunity is that you've been thinking about. Maybe this is your sign. More after the break.
Dangerous Affirmation, The Threat of Gay Christianity, was written to help Bible-believing Christians see the influence of the LGBT movement within our churches, to think biblically about the arguments it poses, and to respond faithfully in the midst of cultural and religious chaos.
Wayne and Michael, you have declared your consent and vows before God and this gathering of family and friends.
Real love accepts people as they are, with room for who they may become.
In the book, I discuss the ways that gay Christian activists are rethinking theology and how this collective rethinking is being used to create LGBT activists within conservative Christian churches. Dangerous Affirmation is an effort to dig below the surface and understand what is truly going on. How do we get here? Why is this happening? What does the Bible have to say about all of this? These are the questions I seek to answer in the book.
Even though I walk through the valley, sometimes it feels like I crawl through the valley. But I got a promise that I hold on tight to. I can't lose when I'm right beside you. Yeah, gotta know the plans you have for me when my cup is overflowing. So while I'm in the in-between, I'ma live my life knowing if I get down, you pick me up from the ground. You give me love and don't give out, giving no conditions. You lift me up and up again now. No matter who surrounds, I let my hallelujah get by like a freight train, sunshine or rain. I lift you up and up again.
Welcome back, friends. That is Up and Up by Colton Dixon, and that's where we're going with today's show. I am so happy when we have shows that are just feel-good stories and stories that empower people, inspire people, and talk about good that is going on in the world. We have enough of the doom scroll, and here on this show, we often tackle tough topics that need to be addressed. But today, blessedly, is not one of those days. And to catch you up, I am talking today to Dr. Natalie Baschynsky. She's a family nurse practitioner, nurse scientist, a rural healthcare advocate who had experience in nursing academics and research with interprofessional partnerships that brought access to care to underserved communities. And we're also talking to Timber Wright, a family nurse practitioner who works in her clinic. Natalie left a successful academic career, went to start Houston County Family Medical Clinic, and that is in Crockett, Texas, and it's about 60 miles away. We've got the city of Chester, which is Timber's hometown. She's been commuting to work at Natalie's clinic, and now through a partnership with Pastor Jordan Wilson, who agreed to be the community partner, the nonprofit organization that coordinated engineering students from Texas A&M to bring a converted shipping container to be a clinic in Chester. Now, you know, I am a nurse. I'm a nurse practitioner. I am a real fan of advocate for care, but I see how lack of access to care really impacts families. Parents who are worried about their kids who are sick or hurt, and they need a trusted voice to be able to go to, and having to drive an hour is sometimes just not possible to do. And so, Timber, let's go back to you and let's talk about your skill set as a family nurse practitioner. There may be some here who are maybe unclear and have questions about what do you do? What kind of services do you provide? Talk about your vision for how the skill set, the education, the certification and licensure that you have really have the potential to transform the health of families you'll be serving in Chester.
Yes. So, I mean, being a family nurse practitioner, working in a rural health community and clinic, you know, we do a lot. We basically are our own little internal medicine people, but we manage a lot of chronic illnesses, you know, from diabetes, hypertension, hyperlipidemia, which is high cholesterol. You know, in the communities, you know, in Chester, Texas, you know, there's a lot of ranchers and a lot of mechanics. So we can also do sutures, you know, as well. So that'll be a big help in the community. A lot of people, like we have a Dollar General now, we call it the Chester Mall. And
I love it.
I'll see people in there and they'll be like, Timber, I hadn't been to the doctor in 10 years, but when I heard you're coming to town, I'm coming to see you. So that means a lot as well. And a lot of people, you know, especially the elderly population, they can get their, you know, medicine sent to their house. So, I mean, they're going to be able to drive some of them 5 minutes, you know, up the road, go to see their doctor, get their blood drawn, because we can also do blood draws. And then get their medicine sent to the house. So that's going to be a huge deal as well. And we see, you know, newborns, you know, right out of the hospital to the, you know, elderly population. So we're not set to one, you know, age. So we do a lot of, you know, health steps, vaccinations, blood draws, sick visits, and just kind of manage, like I said, chronic, you know, care, you know, illnesses. And like Jordan said, mental health is a big thing to me as well. I think the area we live in, it just lacks it. So that's going to be a huge deal for the community as well, because people, you know, are afraid, you know, to open up. And I'm a big advocate for it. I like to educate people. So I think just educating the community, giving them the right resources is going to be a huge help. And I'm excited to be a part of it.
Well, Natalie, you're a longtime advocate for rural health access. You are an expert in that. You've been living this and starting your own clinic and now being able to use your resources to bring that together. What do you see? How do you see the impact of this on the ground? You know, went from vision, what is that reality looking like to you?
Yeah, so one of the things that we know about patients and residents of rural areas is that overall they have poor health, more chronic disease, more diseases that are not diagnosed until too late sometimes. We have more mental health disorders that are undiagnosed and untreated. And so I see this as just generally being able to improve the health of the whole community, and that's what we want. We want the community to feel supported and to be able to have that preventative health care, screenings, medication treatment when needed, but really to be able to give them access and to build those relationships that make them feel comfortable enough to come in and seek care. I think one of the things that we've been able to do here even is to help patients that are uninsured, that don't have access to care, or don't have health insurance, health coverage. We have several programs where we've been able to do things like free vaccinations through some of the programs through the state of Texas. We've collaborated with Texas A&M to be able to offer free well woman exams, hepatitis screenings, colon cancer screenings, and breast cancer screenings, and we'll be able to continue to do that there. So being that, typically there is more poverty also in rural areas. I mean, our goal is to help, be able to do prevention and screenings no matter if patients are insured or not. And that's one of the values with having the collaboration with the Telehealth Institute at Texas A&M also. If those patients come in needing counseling or psychiatric management, we're able to do that at no cost through a grant that's been provided. So, they're really, the goal is really to decrease the barriers and to take those barriers down that prevent people from being healthy. And so we're looking at multiple different ways to be able to do that.
That's what I love about your skill set and being able to do that, and having nurse practitioners in communities like this, healthcare providers in communities like this. This makes a real difference in every day-to-day living. As Timber talked about, from cradle to grave here, we've got new moms who are worried. Am I feeding my baby okay? Are they getting enough to eat? And I'm sitting at home and I'm worried. And to be able to give that reassurance can change the trajectory of the whole postpartum experience. Or you think about people who think, I can't afford my diabetes medication, and even if I could afford it, I don't know where I'm going to get it. And being able to have blood sugar control, that impacts everything. It impacts quality of life. It impacts relationships. It even impacts things like you talked about, Natalie, cancer screenings, people who don't have access or means to get cancer screening. And then all of a sudden they're diagnosed with a late stage cancer. I know, for us as nurses, those things are always really heartbreaking. But the thing that I see in common with each of you is that you each said yes. You saw an opportunity and you said, yes, I will step forward and do that. Natalie, you did that at UTMB. You did that in Houston County. Timber, you did that in Houston County. Now you're doing that in Chester. And Jordan, you did that with your church. What was it like to get your church on board to say, yeah, because it wasn't just you. Like, you had to get your people on board. How did you get consensus for the church to say, yeah, we're going to step forward and we're going to do this?
We just did it. It's a no-brainer. Like, some things don't require a whole lot of thought. People sometimes are like, "Well, I need to pray about this." No, you don't. Just do it. Yeah, you know what I'm saying? And so it's like, what? Why would we not do it? And so, our people. I think part of the great things about this part of the world is, but especially people who are used to going to church a lot of times, is people put a lot of trust in you as the pastor. And we do a lot to try to make sure that we don't abuse that and that we take care of that. And so people trust the leadership and they buy in. It's just good. So I think there's some credibility there, and people know who Timber is. So that's a no-brainer. Know her real well. We didn't know who Natalie was, but we love her. Now her husband, I don't know about that guy.
Well, he is an attorney, so that's a tough battle to fight, right? But such a great skill set for here. Well, Jordan, I've also I've been following this story on social media. Y'all have had some parties and some celebrations. Like, the community has come out in full force. Jordan, can you talk a little bit about what that looks like? Because this is a groundswell of energy. This is something that's being celebrated. I can see it.
Yeah, so it's interesting that the Mr. Beast deal. We didn't have any idea about those guys being involved at all. We knew, who the players were, and then we found out about 2 months ago that there was a silent partner that was going to help. Because I mean, listen, there's a lot of extra expenses once you get the thing on the ground.
Yeah.
You got to get a sewage system hooked up, electricity. It's all tens of thousands of dollars, and so we had no idea. And then once we found out it was Mr. Beast and kind of got over the initial, what? Mr. Beast is coming to Chester? It was like, okay, it was interesting coordinating with them to try to figure out, what they wanted, because they're coming to make a video, right? I mean, Mr. Beast is #1 YouTube guy, period. Like, I think he's the most subscribed, most watched in the world. And so that's their thing. So we knew they were coming, and just trying to understand what they wanted and what we could do to help, kind of get their video together and get the exposure that they wanted. And so we put together a kind of a little block party, I don't know, in the span of about a week or so. And that's the thing about Chester, word gets out about stuff fast. I mean, we planned a fundraiser starting last Sunday for something, and it happened on this past Sunday, and it was phenomenal. Just word travels fast in small towns, and so we got people out there, we got a band out there. I think we kind of understood what they wanted, and we kind of crafted that and created that and got the word out. And and it's interesting because, like, they don't want too many people to know about it because they don't want 8,000 people there, but they also want a certain number of people there so it looks like it's full. So it was just perfect. I mean, we had, the community came out, a couple hundred people probably were there, and we had a food truck out there, and just had a lot of good times. And so the video that you watched, the part in Chester, was filmed a couple months ago, and we couldn't talk about it really a whole lot online or anything until after it was released. And now that's been released, there's other media outlets locally that have picked it up, and so it's been pretty cool. But we still have a grand opening coming, I know, soon that we'll have some more of the dignitaries from Texas A&M come down and stuff like that. So we'll have another opportunity to celebrate. So it's a lot of energy definitely that's coming to Chester. Just the school in Chester is really good. So we're blessed to be a part of that. And like Timber said, the Dollar General there. Now we got a doctor's office. Now it's a restaurant. If you're listening, if you're in the restaurant business, you want to open up a restaurant somewhere, please come to Chester. Please come to Chester and open up a restaurant. That's all we need now. And we'll be set.
It's so beautiful to see everybody using their gifts, though. And it is great to see the exposure that somebody like a YouTuber like Mr. Beast has to be able to bring light to this. And I hope that it inspires a similar partnership in other communities. I hope that there are other university leaders who are listening here who are saying, hey, maybe my university could have that kind of partnership. I hope there's other nurses and nurse practitioners who are saying, maybe I could find that for my community. And I hope there's other pastors and other nonprofit leaders who are saying, yeah, if that came to my community, I would say yes. And to each of you to bring the resources that you have, because each of you has a very different skill set and set of resources and set of community collateral, but it's only in working together that you are really going to make an impact on the lives of Chester. And Timber, I'll give the last word to you. And if you'd like to speak to your community, give a message of thanks, any last words that you'd like to say to express your sentiments about this coming to your hometown?
Well, like I said, earlier, they shaped me, formed me into the person I am today, and just to be able to give back to them in a way that is so special to me, and them welcome me with open arms, it means the world to me. So I thank you, Chester, Texas, and the community. I can't wait to serve you and your family. And like I said, thank you.
Well, Natalie, thank you so much for the compassion, for the excellence, the skill, the way that you use your brilliant academic mind and your hands-on clinical skills to serve your community and to really make a difference. I know that you make a difference to your employees, people who work there for you, people who come there for healthcare. I know what a big difference it has made. And thank you so much for saying yes to partner. Thanks to the Texas A&M students who use their engineering minds. Timber, Thank you for going to nurse practitioner school and for saying yes to coming and getting your training and now being able to take that back. And Pastor Jordan, thank you for saying yes. Thank you to everybody for saying yes. This is just one of those feel great stories that we can all smile and say, okay, when it seems like the world is just going wrong, there is good news to be found. And I pray that you would be challenged to step up in your own community and see where the skill set, the experience, the resources that you have may be able to serve those who are around you, maybe those even in the local Chester Mall, as we heard. But wherever you are and whatever you're doing, I pray, as I always do, the Lord will bless you and keep you and make his face to shine upon you. See you right here next time.